Good afternoon, everybody. Topic for today is home quarantine guidelines for COVID 19. Let's understand these guidelines are specific for those people who have been advised by doctors, are asymptomatic, are contacts of the people who have been diagnosed as COVID 19, those who are mild symptomatic and are not immunocompromised. So let's understand these guidelines are specifically for this group of people. Now let's understand, because COVID-19 is so rampant all throughout the world, lot of people are getting diagnosed with this illness. Now please understand, major chunk of this illness does not produce any great or dangerous symptoms. Most people diagnosed with this disease are asymptomatic or have some mild symptoms like fever, cold, cough, some weakness. Such patients do not need to get panicked, or they don't require hospitalization or any major drugs. Like any other flu, this disease also will go out of the system. Until then, we have to make sure we do not transmit this illness to somebody else, and at the same time keep monitoring ourselves to the point where if at all we are developing any red flag signs or high risk features, then we need to seek help of the doctor. So let's understand. First and foremost, any person who has been advised home quarantine should make sure that he preferably stays in a room which is isolated from the rest of the house. Such a room should preferably be well ventilated. Such room, if at all, has a television, a charging slot, something for the entertainment of the person, that would be great. Another important thing is, this person should not venture into the house where that area is used by the rest of the people. If that room has a facility of toilet, then it would be great. Please understand, during such a time, visitors should not be allowed into your house. And taking care of this person should be done by only one family member whom you consider as to have best strength. He is not immunocompromised, as in he does not suffer from diabetes, blood pressure or other cardiac or renal illness, young and healthy, so that rest of the family members are at least safe from getting transmitted. Now let's understand, apart from taking care of this affected person, the health of the rest of the family is also very important. Make sure that we follow the important pillar stones of prevention of infection like social distancing, masking and proper hand hygiene. Let's understand that whenever this person and also family members, after and before having food, before and after going to the toilet, and as frequently as possible, we have to keep washing our hands. Washing of hands is a proper hygiene where 5 steps have to be followed, which will be explained in another video. Apart from that, make sure that we can use either soaps or disinfectants to wash our hands. At the same time, we should make sure that the affected person wears a mask as frequently as possible. Also, the person who is taking care of him should wear a mask which is snugly fitting. Please understand, such caregiver, after he nurses the affected person, should not touch the front of the mask. He should take out the mask from the sides and discard it in a safe place. Very important thing is, as much as possible, we should use disposable materials like disposable kerchiefs, disposable tissues, disposable plates, spoons, etc. And avoid using the utensils of the house so that cross infection doesn't happen. Please understand that any of this material, once used, should not be discarded simply, should be properly placed in a bag and should not come in contact with the rest of the family. Now, disinfecting the room is very important. Make sure that at least once a day, the toilets, beds, and all the surfaces which are frequently handled must be washed with hypochlorite solution. Please also understand that the caregiver should avoid coming in contact with the bodily fluids like respiratory secretions, urine, and stool. If it is inevitable that the caregiver must handle these secretions, in case the person who is affected is an elderly and is bedridden, in such a time the caregiver should wear gloves and handle these things. After taking out the gloves, he should discard it immediately and safely and should practice thorough hand hygiene. Very important thing is the health of the caregivers should also be regularly monitored. They should get themselves screened for the disease and meet the doctor and get themselves tested. Now, very important thing is, apart from these precautions, the person who is affected should buy a pulse oximeter, should keep checking his saturation frequently. There is a very important thing called the 6-minute walk test, wherein the person walks for 6 minutes and checks his saturation before and after. A drop in saturation should be an alarm sign. It is very important that the person who is under home quarantine keeps in touch with his physician or the treating doctor. Any new symptoms or changes in the symptoms should be regularly updated to the doctor. The person who is under quarantine should know the red flag signs and make sure that if any of them are appearing at any time, he should contact the doctor and get himself hospitalized. Very important thing at last is that the completion of quarantine is not a simple process. The person should get tested and he should get the approval of the doctor before coming out of quarantine. And even after coming out of quarantine, make sure you keep yourself healthy, keep your spirits high, keep in touch with your friends and relatives, interact with them, because it is well known that depression during quarantine is quite high. It is very important that apart from your physical health, your emotional and spiritual health should also remain high during this time. So I request the caregivers, the affected person and all their friends to make sure and assist during this time of crisis. Thank you. If there are any questions, I'd be very much pleased to answer them.